Hi, I'm Dr. Kurt Woeller. So one thing that I see come up in practice quite a bit, and then also comes up through some of the consulting I do, either with patients or healthcare practitioners, is when a stool test, like a comprehensive digestive stool analysis, is done, and the yeast, including Candida, doesn't culture on the stool, but yeast can actually be seen on other sections of the stool test, including specifically the microscopy section where somebody is looking through a microscope into the stool. Well, stool testing is notorious for missing Candida and missing other yeast. It doesn't mean it's not there, it's just not shedding or coming out in the stool in any significant amount. So a culture is where the lab essentially is, has something in a petri dish. A lot of times this is how they culture bacteria this way as well. And they're letting it grow out in the culture medium. But there can be a number of factors that might lead to a lack of an organism growing on a petri dish. And one of them could just be increased immune function or secretions within the stool that might inhibit some of the growth. Or when it comes to yeast, it may not be actively shedding in the stool. Some of the yeast actually becomes invasive, where it can start invading into the lining of the digestive tract. Yeast actually produces a protein called adhesin. And adhesin allows for that organism to adhere, to stick to the lining of the gut. Okay, so that can be one potential reason, but the microbiologist who's looking through the microscope actually might physically see it. They just can't really identify what type of yeast it is. And Candida, by the way, is a yeast. So it's a type of yeast. So, expect to see a fair amount of stool tests that are negative of Candida in yeast, even though symptoms might be present, bloating, gas, for example, indigestion. So one of the things I've often said is you can always rule in the presence of Candida and other yeast when it's detected on a stool test, but you really can't rule it out. Organic acid testing is a urine test. The test that I do comes from Great Plains Lab. And this is a highly effective way of analyzing for the presence of yeast as well. Because these organisms will produce many times, just because of their existence within the gut, what are called organic acids. And organic acids are compounds that we all produce, including organisms living in our digestive tract. And these things get produced either because of their own metabolic activity and or because of the presence of these organisms in an overgrowth situation. There's increased expression of these organic acids that can occur. So for example, Candida, the presence of Candida on an organic acid test can be picked up by an organic acid called arabinose. Arabinose gets produced because the Candida are becoming invasive in the gut, and that causes a chemical reaction. So for years, I've used the organic acid test as my primary way of assessing for the presence of yeast and Candida. And I'll use a stool test to complement the information, but I won't use a stool test as my sole test to determine the presence of yeast, because again, it's often negative. And by the way, that's a lot of labs, right? It's not a fault of the lab. It's just can be a common occurrence. And it really has more to do with the sophisticated nature of Candida and these yeast species. So if you really want to get your best chance and get a very comprehensive view of digestive overgrowth of yeast, is do the organic acid test and a comprehensive digestive stool analysis. Because there's other reasons for doing a comprehensive stool analysis too, right? There's markers for other bacteria and inflammation and digestive function, etc. But again, my recommendation is don't solely rely on a stool test to try to identify the presence of Candida, otherwise you're going to be disappointed. An organic acid test is something that you want to learn how to do. So we do a lot of organic acid testing through our practice. You can also get organic acid testing from Great Plains Lab through Lab Test Plus, labtestplus.com. And it's a test that's appropriate for adults, teenagers, and kids of any means, of any diagnosis. So it's not, it's not a test that's specific to just one group of people. Again, I'm Dr. Kurt Woeller. Thank you.